So I am a huge fan. I think we all assess. I think in life, the first thing we always do is assess. So that doesn't always mean the word assess. It may just mean explore, discuss, look around, any of those things before I make a judgment. Okay, so I just think that that's the first thing I do. Whether it's first, next, last, not last, but first, next, community. I'm going to assess if possible. Okay, that's just I need as much information as I can get before I make a decision. That's the way that I teach. There are four choices. Two of the choices most often are make no sense, rule them out. The two that are left, go back to the question and prove to me in the question where it says that. So many of you are very skilled, amazing social workers, and you bring in your work experience in here, and then the questions, you're assuming some things that aren't in the question. So most often, you've probably heard this before, the answer is in the stem. And what I want you to do is just look for it and go back and then prove it to me. So that way when you walk away, you're not guessing. So those are the vignettes. And I will tell you that I've had a really good month. I've had a lot of people pass and have shared some details with me regarding the test. I'm really, really hearing it's closer to 50-50 of indirect and direct. So less and less of those orientations and more of those indirect questions. So that's how to run an agency, the role as a supervisor, the code of ethics, as well as the community organization. So if you are reading AppGarb, which is my favorite book for content, or any of the services, I'm suggesting that you start from the back of reading that content and go forward and read the code of ethics yourself. I just haven't been able to really find there's no reason just not to read it yourself. Those questions are many times written verbatim. So just read them, read them, read them, read them. Okay. Any questions before I start? So I'm really going to just start with some questions, and I'm going to ask you all to chime in. And if you're brave enough, I'll ask you to please tell me why it's that way. Even if you're right, I usually ask you to tell me why. Just I'd like to hear kind of the thought process of that. So I've probably you've probably seen every question out there these days. There's so many practice tests. I'm gonna switch my screen with you. You'll be over here. I'll be over here. I'm going to close some windows there, get everybody in. I was teaching today and just want to make sure that everybody's aware of the difference between what the primary, secondary interventions and primary, secondary gains. So when you have a conversion disorder or any of those somatoform disorders, we have primary and secondary and tertiary gains. So don't get those confused with the primary, secondary, and tertiary interventions that we talk about. The gains are when someone has a conversion disorder. Again, that's, I've seen something traumatic, I can't see, or, something awful happened in my life, and then my body responds with a physical issue based on that emotional. The first area is called primary gains. Primary gains, and these are only associated with those somatoform disorders. So malingering, factitious disease, all those good ones. So the primary one, no one can see. There's something on the inside that it's allowing me to continue to want to do that. Okay, so that's like the first thing that's on the inside. The secondary gain is when someone notices. So now, I'm getting my doctor's attention or my family's attention, and they're getting benefits. We're all getting benefits from my illness. The tertiary gain is when my whole family can benefit from that, or everybody benefits from that. So those are those primary, secondary, and tertiary gains, as opposed to primary, secondary, and tertiary interventions. Those are things that we use when they came from the public health area. where we looked at ways to stop the spread of disease. I was talking to someone today with the coronavirus. So you'll see that the primary intervention right now is prevention. You'll see the people in Wuchang who are covering their mouths. We've got some screening at the airport. So the minute we kind of have an idea that something's going on, we're trying to prevent it. The secondary would be then people who have it already or people who are at risk of it. So we're doing that screening thing when people come in the United States and making sure that they don't have a fever or anything like that. So we're kind of catching it really quick. The tertiary is the people who really have it already, and we're trying to just keep it contained so it doesn't infect everyone in the world. So those are just some primary, secondary, and tertiary gains. Okay. Let's see, I'll make sure you can see my screen. Okay. Everybody see me and hear me okay and can see my screen? Okay. I'm using social work exam services. I'm going to use a couple of different questions here. Again, if you've seen them before, don't blurt out the answer unless you're going to give me the explanation. That's appreciated. So, 21. A 70-year-old woman cares for her chronically ill 77-year-old husband at home. He has a degenerative disease that will eventually make him totally dependent on her care. She also has a chronic health condition and fears that she cannot care for him too much longer. In counseling her and helping her plan for a chronically ill husband, a social worker would seek to what? Okay, so at some point you're just going to have to chime in or say something. Your text box should be open and you can just answer me in your text box.
Is it 1?
I hear a 1. Tell me why. Come on, be brave.
Because they're assessing.
Okay, what are they assessing? Prove it to me in the question. Okay, you're not in trouble. I just it's 1. So where the question, did you see that? Come on, somebody help her out. Be brave. We're all social workers. So 1 says, help her assess and identify the range of choices that are available to her and her husband, such as home health care and residential care. Possibility. 2, persuade her to keep her husband at home and arrange appropriate supports. We don't ever persuade anybody. Their life, their choices, self-determination. Monitor the situation and intervene as necessary. Okay. Engage extended family members to assist as his condition deteriorates. So I can't really engage extended family members unless they offer me any kind of a release of information. That's not even close to an option. I haven't seen that there. Okay, and before I do anything, so monitor, I'm not going to do yet. Persuade, something we don't do, so that takes it down to 1. Okay, and I'm going to help her assess, identify the range of choices. Because in counseling, that's what I should seek to do. She also has a chronic condition and she cannot care for him any longer. So that's where a 1 comes from. Okay. Okay, just a couple more of those. And I'm really just kind of looking for ones that you can prove it to me, which are less of those recall questions. Yes?
For some reason, my screen is flat.
Anyone else having the same? Did that change it? You see it now? Okay. 53. A group of adolescents is meeting in a junior high school. The group is meeting to discuss their poor school attendance, poor grades, etc. One woman reveals that she is being sexually abused by her father. The young woman is from a middle class family. The group worker would. So normally we know that everything that's said in group stays in group. However, in this case, is that okay?
No.
Because, thank you, Jasmine.
She's making a report of abuse.
Okay, so then what am I going to do?
Would you speak to your
Number four.
supervisor first?
Oh, I heard a 2 and a 4. So 2 will speak to the girl at the end of the meeting before reporting it to the authorities, or 4, call the parents immediately after the meeting to advise them that a report will be made. Okay, so give me rationale either way.
I'm sorry, my screen
Do
is
so you can get
black
more
again.
details and then report it.
I take that back. I think two,
Okay,
and then you want to get more information about it after the meeting, even though
okay,
it's in a group setting.
okay. So this is one where there's a history of sexual abuse. And I think Rob said that. So the concern is that there's some sexual abuse by the father. So if I call that father and that's really going on, what's going to happen? So the father really could
Gonna get worse.
yeah, well, he could abscond and take the child out of our area, and then you could be charged with that. So that's one of the reasons you really can't report to the parent, unless it's a parent that you're working with, maybe in a long time family session. But as a rule, you don't report that to the parent because then you can be charged because you have stopped these are still criminal investigations. We think on our part what we do, but it's a criminal investigation, so you're interfering with that criminal investigation. So I'm not going to call the parents. There's no need to call to the supervisor, and I'm going to speak to the girl. Okay, so I would speak to the girl to get more information and then report it, assuming there's something there to report.
I'm
Okay.
sorry, my screen is black again.
If you might want to turn your camera off if it's still on, because sometimes that slows it down.
My camera's off.
Yeah. I can refresh it again, but I'm not really sure. Let me refresh it again. Okay, 77. After working with a 15-year-old teenage girl with a substance abuse problem for several weeks, the child welfare social worker learns that the child is pregnant. The client is unable to control her drug use, has left a rehabilitation program, and seems unconcerned with potential serious effects on her unborn child. The social worker's best strategy. She's 15, substance abuse problem, and she is pregnant. What do I do?
I don't see your screen anymore.
I'm hungry.
Did that help?
Yes, I am.
Sorry. Thank you. Thank you. I was trying to refresh it. Appreciate it.
Mine is still black. I logged off and came back.
Okay. What am I going to do? We're looking at 77. So rule out the 2 that it can't be. Where would you start?
We don't suggest, so probably rule out one.
Well, in this case, we might suggest. So we don't offer advice, but what I want to do is choose the best out of the 4.
Okay, so rule
Okay.
out four.
Rule out 4. Okay. Because why can't we discuss with her obstetrician?
Because confidentiality,
Yeah,
maybe?
violation of HIPAA. Unless she signed a release, we cannot do that. You got it. Okay, so 4 is out.
Probably rule out three.
3, notify the client that she has been compelled to stop her drug use. You know what? There'd be no reason for any drug, substance abuse counselors, or probably any social workers if that just worked. You must stop your drug use. So we're low out 3 and 4.
So the answer's probably 1. That's
That
your
is
best.
it. That is it. That's the best answer of those. Suggest a girl re-enter the drug rehabilitation program. Okay. So at what point would this be imminent danger and I'd have to do something?
If she threatened to hurt herself
So
or
what if she
somebody else,
kept using with her 15? She's pregnant, she's 15, and what if she kept using?
Then
it's an
wouldn't
unborn
CPS
baby.
get involved?
With her or the unborn?
The unborn.
No. CPS won't get involved until the child is actually born.
Born.
Yeah, that's what I meant. I'm
Yeah,
sorry.
you got it. And even if she continues to use drugs until we can prove some drug use in the baby system, we're really not going to do anything. We can't do anything. She's 15, so I can't report it to her parents unless she has, again, a release of information. So, okay. And those are hard. Those are hard ones when you can kind of see this, and that's when we really have to, try to her right to self-determination. However, trying to still make the best choice for her, or help her make the best choice. Okay. 83. A 10-year-old girl is referred to the school social worker because she is inattentive in class, frequently absent and late, complains of a variety of illnesses, and completes few homework assignments. The teacher reports that the girl seemed tired and morose. After 2 meetings with the girl, the worker asked to see both parents. Initially, the mother declines to accept an invitation to the meeting. The father agrees to meet, but is defensive while discussing an appointment over the phone, telling the social worker that the responsibility of the daughter's difficulty lies with the school. He is known to be generally resistant to suggestions. The social worker would probably next. Does everyone know what morose means? Sometimes I get a lot of my students who get lost in the question because of the vocabulary.
I don't know what that means.
So I think of my here, I'll just Google it for you. But I think of those lovely 16-year-old daughters, kids who are just like very dark and brooding and almost always think of death. That's what I, a teenager at least, that's what you kind of think of with morose. Sullen and ill-tempered. Okay. So most often with my teens, though, they're just kind of, there we go, gloomy, sad, depressed, not a happy camper, extremely gloomy and depressed. Okay. So she is morose. Okay. So now knowing that, so let's see here. She's 10, school social worker because she's attentive in class. Teacher reports the child seems tired and morose. After 2 meetings with the girl, the worker asks to see both parents. Mother declines. What do I do next?
Would you refer them?
To who? Based on what?
I was thinking A, but then I figured maybe refer because it seems like the family needs to be engaged more.
And you think the family would come in to a family agency when they wouldn't come in to see you?
True.
Remember,
I
you're
would
the
go with
best
A.
social worker ever. Okay. So for the test, and when it comes to referring out, you are the best one ever. The only time you ever refer out is when it's in a field of your out of your realm of knowledge. Even then, you're supposed to seek supervision first. So you're the best social worker on this test. Just don't ever always remember that. So
I would say 1.
Okay.
It would either be 1 or 4 because the father did agree to come, even though he was resistant.
He did agree to come. So the question is next. Agree it's probably better to continue to see the girl alone until both parents can be convinced to come. Refer the girl We ruled out 2. Call the mother to reassure they share an interest in helping the girl and try to encourage her to attend. Or 4, see only the father and daughter. The answer is 1. Okay. So we're just not really sure what's going on in this family. And I do want mom and dad to come in, but there's nothing in there that says that this isn't working. Okay, she's asked to see her, and it seems to be going okay. The social worker wanted the mom and dad to come in. However, if they don't come in, I'm just going to send to see the girl unless something changes. Okay. '87. A 16-year-old boy worried about undressing in the locker room. The boy has no genital or underarm hair and believes his genitals are underdeveloped. The adolescent boy is referred to the school social worker. As a first step, the social worker would what?
Would it be 2? 2?
How come?
Well, he's 16, and I think this may be a problem. I mean, that only a physician can help
You
him
are
with.
correct. You are correct. So this is one of those normal human behavior questions. You remember that human behavior class you took back when that everybody hated? That's exactly. He's 16. He's 16. He should have had body hair. He should be shaving, not necessarily shaving, but yeah. So something's going on here. So definitely, let's rule out something medical before we do anything else. Very good. Very good. Normal human development question. All right. 88. The Jones family moves to a new town. Immediately following the move, the younger child develops a competitive pattern of relating to his older brother. At times, the rivalry becomes excessive and destructive. Both boys' schoolwork suffers. Mr. Jones Mr. Jones experiences some employment issues. The social worker might initially hypothesize that these difficulties are so they're new to town. Dad's having some employment issues. The boys are very competitive and actually affecting their schoolwork. So hypothesize. That means before I actually even talk to them, what might I think is going on?
It existed long before the family moved.
How come?
Well, it says immediately after the move.
You got it. All those things have happened. You got it. That's where you proved it. Perfect. Reflected adjustment to a new situation. Let's see here. At times, rivalry becomes excessive and destructive. Their schoolwork suffers. Well, I don't know. Immediately following the move. So you don't think it could have happened before?
I don't know.
Did it happen before they moved?
Yeah, so let's go back to the question. Could it have happened before? So could 2 be the answer as opposed to 1? Or even 4? Suggests no one wanted to move. So go back to the question and tell me in the question what I can hypothesize just based on the information that I know.
Because it's a new environment to the family, and sometimes a new environment can cause new behaviors.
Okay, so what are you suggesting?
Number 2?
Number 2. It is number 2. There's nothing in there that suggests they existed long before the family moved. They moved to a new town. Immediately follow the move, the younger brother starts. Okay. It doesn't say that no one wanted to move. Dad experiencing some employment problems, but it doesn't mean that he didn't choose this. We don't see anything in there saying that. Okay, so the answer is 2. Reflected adjustment, reflected adjustment reaction to a new situation. Okay. 89 is one of those lovely, lovely agency questions. Who wants to be brave enough and tackle that one for me?
Oof.
You'll see lots of those.
Sarah, do you want me to read it?
Would you like to?
Services that meet agency service targets at the lowest possible cost and still meet agency and client goals reflect. I would think cost effectiveness.
It is exactly cost effectiveness. So zero-based budgeting is when you very first start a agency and you have no money whatsoever. None, 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 none. So your bottom line is zero. There are terms such as cost benefit ratio, cost benefit analysis, cost effective ratio, and cost effective analysis. You all familiar with those terms? If you don't answer, I'm going to
Not
assume
really.
yes. Thank you. Okay.
Not really. Can
So,
you explain a little bit more?
yes, I can. Yes, I can. Thank you for asking. Okay. So, in general, when I'm looking for, I'm running an agency, I really want to, there are two things I want to know is how well my money is spent when it comes to the program, as well as when it comes to the my bottom line. Okay, so if you take out if you get a grant from an agency, many or bigger picture, most of them really kind of want to know like, what am I getting out of this? Like, how do I figure out what I'm getting out of this? So it's a very typical business model. Okay, so if I do a cost benefit analysis, the money that I spent, and I ask you to go in and decrease the teenage pregnancy in the area, I'm looking at, was my money well spent? The analysis happens at the end of the program. That's when I'm analyzing what happened. The cost benefit ratio is that number. Ratio is always a number. So I'm looking at, if I spend in $100,000, my $100,000, did I get a good return on that? We saved money because so many girls didn't get pregnant. We didn't have to, provide health care. It's a money issue. So cost benefit ratio is, in the middle of it when I'm looking at the ratio to cost to spending. The analysis is at the end when I'm looking at, then again, cost is money. What cost? What did I get out of it? Now, cost effectiveness is, did I do what I said I was going to do? Okay, so I'm not really looking at the money we're saving. I'm looking at the lives we are saving. Okay, so if I look at, there's always a huge formula if you're a math person, but we don't need the math formula. We need to know kind of how it works. So the issue is then, so cost effectiveness is, did I get my money's worth with the services? Okay, so when it comes to how many people didn't get pregnant, how many kids didn't end up using drugs. So I'm looking at the effectiveness of the program, not necessarily how my money was spent, proof to me where my dollars went, but show me that the children benefited, the old people had more food. So cost benefit analysis is, so cost effective analysis is, was my money effective? Was it spent the right way? Cost benefit analysis is dollar for dollar, did I get my money's worth? Okay, so the ratio is what's happening in the middle, the analysis is what happens at the end. Okay, if you don't have the APGAR book, that's in there. I think probably chapters 8 or 9 maybe. And if you don't, let me know and I'll send you that or some other information. Okay, let's look at 91. Thank you very much for sharing. During an interview, a male client begins talking about his problem at work and at home. They include depression, feelings of loneliness, problems with his mother-in-law, and concerns about his health. The social worker would probably. It's an interview. I don't know him very well. So what am I going to do? Probably. Start with ruling out what it can't be. And I can tell you it's not 4, but we're going to rule out because the answer of do nothing is never, ever, ever correct. They wouldn't be giving you the question if you didn't have to do anything. So do nothing is never correct. Also, a reminder,
I would say 3.
3.
3. You got it. That is it. That is 3. Good job. Okay. And the client suggests a primary issue for which she is having difficulty. That term is also partialization. So we kind of like partialize the problem, break it up into pieces so we can figure out where to start. Good. 92. The best placement for a 12-year-old boy who is physically aggressive, destructive, and has been diagnosed with severe conduct disorder would probably be. Where are we going to put him?
Four.
How come?
Well, I remember learning about the alternative schools,
Mm-hmm.
and with the physically aggressive and destructive, and he has a conduct disorder. So I just remember like the alternative schools
Okay.
for, I guess, troubled teenagers, maybe.
There sure are. There are most of your schools in your area have most of the time what we try to do is divide up the emotionally disturbed children with emotional issues separate from the conduct disorders, because as you all know, the conduct disorder kids are mean. And a kid who already has emotional issues, those two would not be good items. So in most areas, we try to separate those if they're in separate school systems. This has also to do with the least restrictive environment. Okay. It doesn't say he's having any problems at home, does he? It doesn't say that. So pulling him out of his home doesn't seem to be an option because it doesn't indicate that. Okay. I can assume because his conduct, he's probably having issues at home, but it doesn't tell me that. So a small group home with permissive living atmosphere and home instruction. Again, doesn't say anything about his home. A day treatment geared to treat children having problems at school. Okay, that could be an option. 3, a foster home where his acting out behavior would be understood and accepted. There's very few foster homes that would accept that. And again, B, the problem seems to be physically aggressive and
At school.
destructive. Well, if physically aggressive and destructive and has been in place with severe conduct disorder. It doesn't say at school, does it?
Oh yeah, it doesn't say
It
that.
does not. I read into that where it didn't. It does not say at school. It just says in general. And I read into that. That's exactly what I did wrong, is read into that. Thank you. It is 4. It's a residential school where his behavior would be regulated through routine, discipline, and relationship with adults and peers.
And see, I was
Okay.
actually gonna change mine to 2 because when you were talking, I thought it was at school. So I looked back and I was like,
Yeah,
well, if that says problems at school, but then
that
I
would
don't
be
see it.
it. Yep. And my bad. Going back to the question, looking at it, it did not say anything about school. So the assumption is it's probably both places. So yeah, thank you. So untreated conduct disorder when he's 18, what are we more than likely to diagnose him with?
Antisocial personality
Oh
disorder.
gosh, yes. Good, good, good. 93. A social work supervisor wants to ensure the effectiveness and experienced workers remain with the unit. Other unit heads and agencies are competing for staff, and it's difficult to retain well-trained workers. The most effective means to, and again, this is one of my community questions, so
Would it be A or 1?
how come?
Um, well, it's geared towards the workers, and they want to see what would be the most effective. I don't
Okay,
know.
okay. It
It just
is.
sounds good.
It is one, and it does sound good, but let's figure out why. How about that? Okay. So, increase opportunities for new and varied assignments. Question anything about that? And this doesn't say they're complaining about that, does it?
No.
No. Develop more educational and in-service opportunities for staff to improve their skills. Let's go back to the question. A social worker supervisor wants to ensure the most effective and experienced workers remain with the unit. Other unit heads and agencies are competing for her staff. It's difficult to retain well-trained workers. The most effective means is to. Okay, so it doesn't say that Let's look at money. Support higher salary increases and provide assurance of long-term employment.
That does nothing if they're not involved in, getting like learning more and being more efficient in the program. And
You got it.
I don't know. That's
All of
all.
the methods listed are important components of worker satisfaction, of course. However, positive feedback and involvement in decision making are key elements in worker satisfaction. And I think all of you could agree with that. That when it comes to your job, if you had more
Say
input,
so. Hmm.
wouldn't it matter? Instead of
Yep.
being told what to do, that's yeah, exactly.
It just makes you feel like you're a part of the company and not just a body.
Ooh, okay, I'm gonna go there. So if you're just a body and you're being told what to do, is that X or Y management style?
Mm, that's why.
That's X. X gets the work done faster, but we don't really care what you think.
Oh, right, right.
Okay. So the X is called the scientific method. The Y is what? Human relations method. And the other one is called the Weber's bureaucratic or bureaucracy method. So those are also in that APGAR book, or you can look, again, if you don't have that information, I'll supply it to you. But those are those areas of scientific management. I mean, those areas of management.
I gotta work on those more.
Let's see here. It's 97. A social worker interviews a couple for the first time. They've lived together for 7 years and decided to marry. A wedding will take place in 4 weeks. Arguments have risen over money, cooking arrangements, Mr. Brown's spending habits, and Mrs. Smith's coldness and interest in cultural television program. They begin the interview feeling they should cancel the wedding. The social worker should.
I like 4.
How come?
Well, because I don't like suggesting anything, and we're not going to refer. So clarifying the disagreements sounds better
Okay. So why am I not going to refer him to the clergyman?
because it doesn't say that I'm the best social worker.
Because I'm the best one to treat them, right? You got it. It also, does it say anything about their religious beliefs?
No.
Nope. So this may be held in their backyard. There's nothing to indicate that they have any religious issues going on, right? 2, suggest individual treatment since the issue has deemed embedded in their character.
No, because it says that in their interview, you were with the couple, so you can't separate them.
Perfect. They're seen as one. You got it. 3, suggest the wedding be temporarily postponed.
No.
It's not our decision.
It is not, and they're going to come back and try to get me for some money. I don't think so. No, no, no. So 4 is the best out of those choices. Okay.
Since they came in as one, you have to see them as one.
So yes, so a couple, group, and the individual still seen, or family, they're still seen as one unit.
What about sex therapy?
Have you seen it on the APGAR on the test?
No, I'm saying I read it where if they have like they're coming in for sex therapy, then they would see them individually. But if they came in together like a couple,
Something happened. Okay, so usually if it's sex therapy and it's still a couple, but the answer to that one now most often is just seek medication. Because what we see most often is that the man comes in with issues being able to perform. So
and usually you refer, don't you, to like an MD?
Yeah. I can tell you just from private practice, being in the practice before we had that lovely blue pill. Poor guys. We spent like hours in session, trying to, make his wife understood that he still loved her. Blah blah blah. So definitely, how things have changed when it comes to seeing couples. Okay. Okay. Let's go to the next one.
Can I chime in on that one?
Please.
I've taken the exam a lot, and what I've seen on that, you would just refer if there's any like sexual, dysfunctions or anything like that. If they're complaining like something in the bed, as social workers, we would just refer to an MD.
We would. Very good. Okay. 102. Let's look at this one. A group of adolescent girls comes to a neighborhood center and asks the youth social worker for a room that they can regularly meet. Has anyone seen this question before? I've seen it like several times, like other test forms. That's a no. Okay. The group is not interested in joining the center, and the girls' comments clearly imply that they want to use the room without interference from staff. The center's policy is to require registration for all participants and to monitor groups from using the building. They're also expected to report on the activities to the Youth Services Director to ensure compliance with the center policies and to permit staff to facilitate their activities. The social worker does not want to lose this opportunity to serve a local group. In this situation, what does she do?
I'm thinking 3 might be the best.
Tell me why.
Well, based off their policies, they want to make sure that there's a reason, like a justifiable reason. So I think arranging a meeting with the group to discuss like why and what their needs are, and what the policy requires.
Okay.
Before making a decision.
So let's rule out. Okay. Say nothing about the policy. Register the group for a room, and trust that her skills will persuade the group to accept the policy.
Absolutely not.
No.
I like my job. Just saying, I need to feed my kids. That can't happen. Okay, so that's out. I am not going to say anything, and also I'm really not going to. I'm not going to bend the policy. So 2, discuss the value of sender services with the group and suggest the girls talk over the situation among themselves before making a decision. No. I do discuss the value of the center services to the group, and I really do want them to stay. Right? I'd rather have them at my agency or someplace we can keep an eye on them than out in the community. But 3 is the best answer. Arrange a meeting with the group to discuss their needs, the requirements, and the advantages of registering before they come to a final decision. Okay. B4, explain the regulations are set by the board and cannot be altered. That's true. I mean, you could say that, but that's not the nice way to say it, is it? I mean, we want those kids to come back.
I don't think it's the best one.
Yeah, 3 is the answer. You got it. Okay. 104. A social worker staffing a hospital surgical floor has a play group of 6 children. One 6-year-old girl whose baby brother was born shortly before she came into the hospital for surgery demands that the group worker feed her and carry her to bed. The girl's mother visits frequently with the baby and seems to respond mainly to the baby's needs. Based on her understanding of this dynamic, the best way for this worker to help the child is to what? So she's 6. She is surgical floor with 6 kids. One is 6. The baby brother was born. The girl's mother visits frequently, but she's taking care of this new baby.
I would think 3.
How come?
Because there's changed roles in the family now, and the child might just be afraid.
Okay. Let's look back. 1, refrain from helping her this way because the worker cannot do the same for all children. No. And we wouldn't try to do the same for all children. That's just not an option, right? We treat everybody as individually as we possibly can. 2, recognize the child's temporary regressive needs and grant her request. Why would I not do that?
I like that one. I don't know.
So why would that not be okay?
I think it is okay, actually.
Well, okay. So I guess the problem more is how long is she going to be there?
Doesn't say.
She can't do it forever. I mean,
She can't. She cannot. Okay. And while I can put a Band-Aid on there, is that the best way to help this child and the mother?
it doesn't help the
Probably not.
underlying problem.
Exactly,
Yeah.
exactly. I mean, definitely, while she's there, I'm giving her more attention than she needs. But the bigger issue is this poor mom has got two sick kids, one in the surgical floor. I'm sorry, and brand new baby. So I really just want to kind of figure out like the best I can do because this isn't going away tomorrow, right? Mom's going to go home. She's got this kid who just had surgery, and she's got a new baby. So let's three. Help the mother understand the child's need for support, affection, and security. Okay? It is a 3. Oh, let's go there. I'll throw in a research question. 106. A patient in a mental health hospital stole food and hoarded towels. A program of positive and negative reinforcement techniques have begun. Stealing and hoarding were reduced as a result of this incident. The reinforcement technique that was used should be what? What happened there?
Oh, this is tricky.
I have no idea.
Okay, so let's look at one or
I hate
two.
research.
There's not hard. It's so not hard. It's not. The way your teacher taught you back in grad school was just mean, okay? It's not that hard. So let's look at it though. So of the terms that parallel variable and are causal variable terms that you're familiar with?
No.
I've seen it, but I don't remember it.
Okay, so let's for temporary rule those two out, okay? Because those are usually the terms you're going to see are terms you've seen. So let's look at independent and dependent variable. Which does what? What's my independent? What's my dependent?
The cause is
The dependent. Well, no, I don't. Let me
Come on.
The independent.
Come on.
The independent changes, right? Or I don't know.
Okay. So the best way for me is my dependent variable is just kind of sitting there waiting for the independent variable to do something to it. Okay. So if I have coffee, I'm waiting for something to add something to my coffee, but it's just sitting here. It's dependent. It's dependent, waiting for the independent variable to do something.
The dependent is waiting. Okay.
Okay. So then, a patient in a mental health hospital stole food and hoarded towels. A program of positive and negative reinforcement techniques had begun. Okay. So then, the stealing and the hoarding were reduced as a result of what? It was reduced. So what I'm looking for is a reinforcement technique. Okay. So what changed?
she stole the food and ate it.
Did she stop?
No.
Stealing and hoarding were reduced as a result of this. Right?
I don't
Stealing and
know.
hoarding were reduced. Okay, they stopped it. So the patient was stealing food and hoarding towels. The intervention, they have positive and negative techniques, and then it stopped. It reduced the hoarding, right? Okay. So then, what changed in this one?
She stopped stealing and hoarding.
Okay. Okay. So then, is that my independent or my dependent variable?
Independent, because the reinforcement technique was the dependent, right?
So the reinforcement technique is the independent. Intervention is the independent variable. Okay? The dependent variable is the change that's being measured. So that's what changed. Okay? So she was stealing food, trying to take food. Okay? We introduced an independent variable. That is that reinforcement technique. And therefore, that decreased that behavior. So the dependent variable was sitting there. The food and towels, hoarding the food and towels, right? That was the problem. It was just sitting there. I introduced an independent variable. Oh, look, let's do this. And then therefore it affected my
Okay.
dependent variable. So the answer is 1A. It's independent variable. That's my intervention.
Yeah, let's hope we don't get that on the test.
Okay.
Yeah.
Okay, let's see here. Here we go. 108. A group of adolescent boys and their girlfriends regularly drop in to play basketball at the Greenwood Neighborhood Center, a community social worker with a varied program of activities for children and adolescents. The group has recently been joined by several boys who are known to be involved with drugs and who are thought to be dealers. The agency outreach worker is concerned that the group might begin to shift its focus from sports and recreation to more destructive activities. In addressing this issue, the social worker might.
So we know it's not one.
Okay.
It's good.
I think it's 3.
How come?
Exclude the new boys. 3? No.
How come? Either way, you still have to prove it to me no matter what you answer.
2?
How come?
Okay, well.
Let's go back to the question. A group of neighborhood boys and their girlfriends regularly play basketball at the center, right? We liked them there. It was cool. They're safe. We liked them there. The group has recently been joined by several boys who are known to be drug dealers. The agency outreach is concerned that the group might shift its focus from sports and recreation to more destructive activities. What she's afraid of is if we continue to let the drug users hang out, that this may not be the safe, friendly place that it's been so far. Okay? So how does she address the issue? Now, she's a community social worker, so she's really looking at what's best for this community.
Well, if you feel that the shift might go from recreation to drug use, then she could use she can do like an intervention, like a educational technique to teach them about drug and alcohol so they won't shift
Who?
without excluding singling out the 2 boys.
Okay. So the number 2, invite the entire group to join a psychoeducational group on drug and alcohol abuse. Okay. So I'm just thinking that those drug dealers might not attend that meeting. What do you think? I'm just thinking, yeah, they're not really interested in learning anything about drug and alcohol abuse. Now, my new kids who are not the users, those I definitely would want them to come in, right? Because they're the ones who are still vulnerable. Those are the ones I can still work with. But my hardcore drug users over there, they're not coming to a meeting to talk about their drug use. So I got to rule out 2. How about 1? Discuss the problem with the 2 new boys and convince them to leave the group alone.
The 2
don't
new
tell
boys
people what
are the
to do.
people who do the drugs.
Yep.
And convince them to leave the center.
The center kids alone, the good
That's
kids.
probably not smart.
No.
That'll cause trouble.
Okay. And do I see anything in there where the kids don't like the group? I mean, the group has been recently joined by several boys who are known to be involved in drugs and thought to be dealers. But it doesn't say that those kids aren't happy. Hey, the drug dealers are hanging out with us. They're not complaining.
So it's not 1 or 2.
I think it's 4.
It is 4. Arrange to develop a close relationship with the boys and try to involve them with more center programs. Okay, with the group. Okay.
So maybe possibly they could like convert to not doing selling the drugs anymore.
Exactly.
Makes sense.
Okay. Or the other kids at least will get benefit of coming from the group, and the drug dealers might just go away. Okay. 127. A caseworker with good professional training but little experience believes that a 15-year-old boy whose family is dependent on public assistance can probably meet his own total needs during the summer months. His total needs include clothing and payment to his family for the cost of room and board. This worker was partially self-supporting at the age of 15 and believes that healthy children can, if encouraged, act as if she did. In the conference with this worker, the supervisor should say, or should do what?
One maybe.
Encourage the worker to develop this aim in all healthy adults, provided it made a constructive experience.
No.
What? He's 15.
Permit the worker to carry out this. No.
I don't know. It said healthy. I don't know.
2.
Okay, so let's go back. So this is because this is a normal. There's two things going on here. We're looking at transference, countertransference. But we're also looking at normal 15-year-old behavior. Okay, is it normal that a 15-year-old would be able to pay rent and do
No.
clothes shopping, all those things in
No.
that summer? Okay, so that's not one is not true. That's not a healthy adolescent. Okay.
Sorry, I'm
My
trying to do like 3 things.
22-year-old is in grad school and she still can't figure that out by herself. So this is not happening.
What about 2?
Okay. Discuss the needs and the capabilities of the child and the limited job opportunities available to fit the abilities. That makes sense because definitely, that's just not an option. 3, permit the worker to carry out this plan since it will help her resolve her own adolescent conflicts and will not harm the child. Problem with that?
We don't know that it won't harm the child.
And since when do I get to resolve my own issues with my patients? I'm pretty sure that's not my role, right? I don't get to do that. Okay. 4, point out to the worker that she has a need to punish others because of her own deprivation.
No.
Which might be true, but that is not the role of the supervisor. Not it. So 127 is 2. You are correct. Okay. $133. A 58-year-old male is referred for a HMO, primary care doctor, to the mental health unit for assessment. Referred to a young female clinician, he seems friendly and open, but says he wants a male clinician who is closer to his own age. He reveals that he has an emotional and physical problem that he wants to discuss, but does not feel comfortable discussing this with a young woman. Though the worker and the client talk politely, he continues to insist that he will not discuss the problem with the worker. What do you do?
4. Self-determination, right?
I don't want to assess him before I do anything else there.
No, he asked you.
He said he wasn't going to do it.
You got it. You got it. And he's 58. He's been polite, but obviously, whatever he needs to discuss, he doesn't feel comfortable discussing it with this a young female. So yeah, he has the right to that. Okay. Let's look at 5. Susan, age 16, tells her school social worker that her stepfather has sexually molested her and her Lisa, her 10-year-old sister. The worker knows the family's problems include the stepfather's unemployment, alcoholism, and occasionally outbursts of anger at the children. The mother seems concerned with her children and has had productive discussion with the school personnel in the past. Susan is occasionally truant from school and has intermittent involvement with drugs. What should the school social worker do first?
I would report it.
Anybody else?
1.
1, we're going to report it. How come?
Because she told her that he molested her. It's not like she's or the social worker suggested it and needed to get more information.
Got it. You got it. She reported it to me, and is my job to get more information?
No,
It's not.
that's
It is
what
not.
CPS does.
Not
Exactly. I'm a school social
investigator.
worker. You got it. If I have concerns, I'm going to report that. You got it. Very good. How about this one then? So if Susan's allegations of sexual abuse is later confirmed, a protective service worker would likely recommend an immediate strategy to protect the children. Which of the following would be the best immediate solution?
Removal.
Removal of who?
The girl
Wait,
and
3.
Susan and Lisa.
I think you should remove the stepfather. Wait.
I
Okay.
thought it was that Lisa's her little sister,
Right.
and Susan is the girl that was being molested.
You got it.
So remove both of them.
So why do I have to leave? Why don't I make the dad leave?
Yeah, the dad should leave.
I don't think you could force somebody out of their house. I don't know.
You cannot. You cannot force him out of his house. So what happens many times in those cases is we have asked the stepdad to leave, and mom says he can stay. Then we have to remove the kids because mom won't make that decision. So the first choice, the first thing is 3. Ask the stepdad to vacate the home. Okay. And oftentimes he's like, and mom's like, he's not going anywhere. That's my man. Blah,
And
blah,
then you
blah.
take the kids.
Then you take the kids. But so Susan and oh, come on, you've been in this field long enough to know that's exactly what happens.
Yeah, ridiculous.
But so what happens with like Lisa and Susan? You know what? So they haven't done anything wrong, and they have to leave their home. So it's like you're punishing the victims.
Right.
Yeah, it causes more trauma.
Exactly, exactly. So the first thing is the stepdad should leave. If he doesn't, then I go on, okay? How about number 7? Untreated family problems such as those in question 5 are thought to lead to what? So if we go back up here, and if, these things are not treated, the outbursts, the possible sexual abuse, the stepfather's unemployment, alcoholism, and outbursts of the children. So if we don't fix that,
Fix that in the dad. Is that what?
The family.
2.
Say that again? 2, exactly. So if we grow up in this and we don't have that CPS intervention, then we're going to most often recreate what we saw. So as much as we try not hard not to, I tell my students, we are, I plant what I am. So, a tomato seed doesn't produce lemons. So if I continue in this and keep doing this, I'm going to grow these little tomato seeds. So got to change the family. How about this one? Early treatment for children who've been sexually molested by their father or male caretaker does not usually involve what? Early treatment. They've been sexually molested by their father or their male caretaker would not involve.
4.
How come?
You don't want to have therapy with the person who molested you?
Absolutely. I have seen families get back together, and we've done some family therapy only after father's gotten lots of help. But early treatment, 4. You got it. 10. A mental health social worker is subpoenaed in child custody battle between 2 parents involved in a bitter and sometimes a violent divorce. The social worker has been treating the mother. The father's attorney asks a specific question about a statement the mother might have made in treatment. Which statement reflects the social worker's legal obligation to the client and the expectation to the profession?
I'm confused because it says subpoenaed, but it doesn't say like by the court. So
It
would it
does
get?
not. It does not. So
So
then,
that's just a lawyer.
let's see here. They've been true. It doesn't say by the court, so we have to assume.
So then you don't say anything. You just
One.
keep confidential.
Okay, so we've talked about before that if you've had it before, a subpoena is a if it's from the court, I mean it's from an attorney, it's a birthday invitation, but I would RSVP and say thanks for no thanks, but keep
So
reading.
it's
I'm in
two.
court.
It's two.
Oh.
Because it says unless ordered to respond by the judge, so it would
You
change
got
it.
it. You got it. You got it. And I'm not gonna I'm not going to refuse to answer the questions. I'm just going to say that's privileged information, limited communication, any of those things. That's just more professional. So say nothing. That's not going to be the answer. But yeah, but I don't look good in orange or green or stripes or whatever the local jail color is. So I am definitely going to respond to the judge.
And Miss Pam, can I say something too? I
Please.
noticed that on that question there, I didn't realize until the end, but everyone make sure you're reading the whole thing because I tend to not do that, and then I changed it because on number 2 it says at the end unless ordered to respond by the judge. Sometimes you'll read the first half and like, oh, that's it, or not it, and then it's really wrong because you see the first one says not to, but then it says unless ordered to respond by the judge. So it kind of
Very
changed my
good.
answer.
Exactly. Very good. 12. A social worker in a neighborhood center receives definitive information that a 14-year-old boy from the area has a pistol that he carries to school. The worker's information suggests that the boy intends to intimidate others with whom he is feuding. The worker has legitimate fear that the boy could shoot someone. He is known to the agency, has an angry disposition, and is predisposed to fight. The worker's first action is to
3, notify.
Okay, so how come not 1? Talk to the boy and urge him to surrender the weapon or dispose of it voluntarily?
Because he can shoot her.
Well,
He could. You got it. He could shoot her.
Safety first.
But I also don't want him to dispose of it voluntarily. I don't want him to throw that gun away. That's it more than anything. Okay, so to surrender the weapon would be fine, take it to the police and turn it in, but I definitely do not want him to dispose of it voluntarily because toss it in a garbage can so somebody else can get it. I don't think so. Okay, discuss the matter with the boy's parents and ask them to intervene before something happens. Why not?
Because he could kill somebody in that time.
It's true. Do we see that he has parents?
No. Well, he got somebody.
He's got somebody. But I don't. There's nothing in there that says mom and dad are involved. Okay, and that is correct. I'm going to notify the school officials in this day and age, and I really have to make sure that if I have good reason to think he's going to hurt someone else, I've got to do something about it. Okay, so definitely. 18, an adolescent confides to his school social worker that his parents will find out from the principal that he has missed several days of school. Frightened by the punishment he may receive and concerned about his parents' disappointment, he asks the social worker what to do. The best response is to say what?
Three.
How come?
3.
How come?
I think it's
Since you broke the rules, you have to be willing to accept the consequences. That's true, isn't it?
that's true. I just don't think it's appropriate for the social worker to say
Not
that.
the best response. You got it. And remember those best ones? There are several that could be a possibility, but I'm looking for the best one. Very good. Okay. Okay. 26, a client in a mental health clinic was asked to participate in a funded research project during which the therapy session will be observed through a two-way mirror. Clients in the research project will pay lower fees. At the start of the project, clients sign an agreement indicating they understand the research program and what will be required of them. 6 months after the project begins, one participant, William, tells his social worker he does not want to be observed. He will not discuss the issue and wants to be released from his agreement and drop from the project. But he also wants to continue treatment. The social worker's best response is what?
I would say 4.
How come?
Well, because he has the right to end it, but to be in the treatment program, you have to be in there so they can refer him somewhere else.
3.
Say it again. Yeah, just repeat what you said.
Me?
You said in order to be in the treatment program, he has to be in to get referred. Is that what you said?
I thought the program, it was a part of the program is to be in the the experiment.
Mm-hmm.
So I
The
was
part
thinking,
I can't read it all, but didn't it say that it's free if they're in the program?
It is free if they're in the program. You got it.
Right.
oh,
So okay, yeah.
So the answer is 4. It is 4. Okay. So he has the right. That's the research. It's one of those IRB, informed consent. You have the right to leave any time. No questions asked. Okay. So as a client, he can make a choice to end the participation, and I'll help him. I'll refer him to somebody else. Okay. So that's that whole issue of why the IRB formed, because of the issues of people being unaware of the full treatment goals or being forced to participate in treatment they didn't want to be in, all those things. Okay. So yes, he's got the right to walk away, no questions asked. Okay. 28. During a serious psychotic episode, a patient who lives alone voluntarily signs himself into the inpatient unit. After 3 days, the patient decides to leave and refuses to consider a longer stay, though the social worker and the medical staff agree he needs more inpatient treatment. The social worker's best option is to
2.
How come?
Oh, wait.
sorry, my phone died.
Wait a minute. He's having
I
a
can't.
psychotic episode. So is he even competent? Well, he was competent enough to sign himself in. If he wants to leave, I guess he can, but because he's not court ordered to stay. So the best thing she can do is just, I don't know, 1 or 2. I give up. I don't know.
Okay, so let's go back. During a serious psychotic episode, a patient who lives alone voluntarily signed himself in an inpatient unit. After 3 days, he decides to leave and refuses to consider a longer stay, though the social worker and the medical staff agree he needs more inpatient treatment. Okay? So then, we do know that if you are having a psychotic episode, you have lost your right to self-determination. We know that, right? But he's not. Do we know he's still psychotic? That was 3 days ago. Okay, so now it's 3 days. So if there's anything in the question, repeat.
Can you just recommend?
You can recommend. You can. So the answer is 2.
Because he doesn't want to stay, so you might as well help him.
You got it.
Find something else outside of the hospital.
You got it. Okay. However, now if the question said that he was still actively psychotic, if he's not under a suicide watch or he's not in imminent danger, then he still doesn't have the right to make that decision. So I'm going to probably seek a court order Okay, because I was going to say he's not capable of making that decision, but in this one, it doesn't say that at all. It was 3 days ago that he was psychotic, so he has the right to leave. What's wrong with 4?
Confidentiality.
Got it. You got it.
Can you tell me what the answer was? The one before this? My phone died.
I can. I don't remember which one we did though.
It was
I'll go back.
4.
It was, what number was it though?
This 26.
26. Okay, it was 4.
This one here.
That was 4.
Oh, okay. So I was right. Okay, thank you.
Mhm. This one? I did that one already. That one talks about malpractice. So if someone's suing you for malpractice, can you do you have the right to release that information?
Yes.
Yes.
You sure do. Okay. Number 53. A social worker discovers that her female client is HIV infected and is also sexually active. She does not inform the partners of her illness. The client maintains that she has always used safe sex. And she's always used safe techniques and would never knowingly put anyone in risk. The social worker is concerned that despite the client's precautions, she should notify her partner so they can take appropriate protective measures. Which statement best describes a social worker's options? Okay.
3.
How come?
Well, because all you could do is pretty much educate her on her behavior and the risk she's taken. That's
Okay. Let's rule them out. The social worker should contact the Department of Public Health and ask them to meet with the client. What's wrong with that?
no. Confidentiality.
You got it. 2 is never the answer. I can't not do anything. Never, never, never the answer.
And you don't demand them to do nothing.
And then 4, the social worker should demand the client to stop behaving in such a way that puts others at risk. Okay, and that's, yeah. Okay. So that's the best option, is discuss the matter fully with the client and explore the meaning of behavior and the risks she is taking. So this is this was on the question was on my Facebook page this week, and lots of controversy depending on whether or not you
Duty to warn.
Okay, so then so the issue is it really depends on your state. I tell my students now in my college classroom is it depends on their agency. Because whatever their agency has said is what you follow. The case has not gone to the Supreme Court, so until then, everyone's kind of very we don't want to make a decision. We're afraid of being sued or what might happen. So there's really not a definite answer on whether we share or not. Are they in imminent danger? You don't always get infected because you have sex with someone. So that's a tough one. That's a tough one. I can tell you, I started off my career when AIDS first came out, and we had no idea how it was spread. None. And I worked in a clinic. We served lots of prostitutes in Fort Lauderdale, and we had women who would come in all the time who tested positive, and would come in like 2 weeks later and test positive for syphilis. And at that point, it was so new, no one knew what to do. You used to have, before we had universal precautions, you'd have like a neon or a green sheet of paper that said this person has HIV. So we really just didn't know. We didn't know how it was spread at the time.
They had to walk around with that?
They did. And you pulled out the folder and everybody could see that it was neon.
Oh.
So we didn't know. The school system, we had kids in kids in care who had, who'd been positive, and we just didn't know.
Wow.
Okay.
Miss Pam.
Yes.
So I was hoping that you could help me. I seen a question on one of the Facebook pages today, and there was a lot of back and forth, and I was hoping you could maybe address it because I'm confused. Dealing with like child abuse,
Hmm.
I never heard anything about like reporting the incident according to the state law. Is that
So child abuse is a federal law, not a state law. So that's a little surprising. Elderly abuse is a state law. So every state has different laws on what you do, but child abuse is a federal mandate. That's a big one.
because
What
they're
was the
saying?
question?
Okay, so it says a social worker is attending a neighborhood block party. While speaking with her neighbor, the neighbor discloses that she was frustrated with her child the other day and she hit her with a belt. While the neighbor is not a client of the social worker, what should the social worker do first? And
Should
I
report
said,
it.
yeah, I said A, make a child abuse report, but everybody keeps saying the answer is B, report the incident according to the state law.
Well, how would it be? Would it be child abuse if
Yeah,
she
because
hit
it's
her
the
with a
object.
belt?
Oh, it may depend on the state because, like in Michigan, the law states that you can only hit a child on the bottom with an open hand.
Right, and this is an object, but
But
I
you're a mandated reporter. You're a mandated reporter throughout and that's a federal law, and you're a mandated reporter. So whether you're off duty or if you see something in the grocery store, you're mandated. You're supposed to report.
I thought anything with child abuse you report.
Okay. And when it comes with open hand or closed hand, I mean, every state does have like rules of like what it looks like, how long the
Hmm.
mark can last. I would agree. However, that's not my job to decide unless
But
I'm
it's a situation.
CPS.
It's a belt, so it's an object.
It doesn't matter. It doesn't matter.
See, I
The what
thought it's like a physical. It's a
it,
phys-
it's so it what matters is I am a mandated reporter. If I think that child is being hurt, I have to report. I don't
right.
decide if it's a belt or a shoe or no, it doesn't matter.
And then a lot of us were saying, just mind your own business. But as social
That's not an
workers,
option. You don't get that option. You're a mandated
right,
reporter. You're a
we
mandated
report
reporter.
it. So
Okay.
I don't know if you guys, anybody else in the group, seen that on Facebook today, but it's just been a thing and it's been in my mind. So I thought I messaged you earlier about it, but
Maybe you did. I wasn't
so
looking.
report it.
You are a mandated reporter, whether you are sitting behind your desk or having dinner at Fridays this weekend. You're a mandated reporter. If someone says, I told that social worker and she did nothing, the license you worked so hard to get, you're going to say goodbye to, okay?
I'm
You're a
gonna tag.
mandated reporter.
If you're in there, I'm gonna tag you just so these people.
Okay. And believe me, I'm not trying to start a fight with any other tutors. I'm not going there. I'm just saying you're a mandated reporter.
It's just like people that find maybe they had an issue with it too and just posted it, but I don't. I was just confused myself. I'm like, no.
And there are different state laws, and it works very different. However, some laws says if it leaves like five fingers last for 24 hours, it's a hand. But that's not my job. Unless I'm working for CPS, I don't decide that.
Right, right. Okay, thank you.
No problem. Thank you. Well, let's do this one. So we talked about beating. Okay, so 54. A woman admits to a social worker that her husband has been beating her for several years, but she's afraid to report the violence and reluctant to leave him. Twice the police have responded to the neighborhood complaints and arrested him, but the abuse only stops for a short time. The social worker might first consider what?
One.
How come?
Well, first of all, you wanted her to understand that she does have options and explore, like give her like choices to go to a woman's shelter.
I think it's two.
How come?
Because you assess first.
Ooh, that's a first one. So instead of helping her understand, I need to assess because she might already understand, right?
Oh yeah, that's educating, huh?
Hmm.
Nice one.
Okay, so helping her understand that she has options and willing to explore moving to protective women's shelter if she is willing. Okay. Um, Again, I don't see anything up there that says she. Does it say she wants to leave?
No, she just.
She said she's reluctant to leave him.
She might have family to go to, might she? I mean, why am I offering her an abuse shelter? I don't know enough, so that's why I'm going to assess the reasons, both unconscious and both conscious and unconscious, why she which might contribute to keeping the client in the abusive relationship, and providing information with resources after I assessed, as she chooses to make a change. Okay.
Can you talk about the steps we should take to answer these next questions?
Okay. So what I do is I rule out the two that it can't be. Okay. So I would look at request the agency discuss the client's legal rights with her. I don't know that she knows her legal rights. I don't know that's even an issue. So I'm probably going to rule that out one. It's the first question. So my first thing says I'm going to assess. So that's what my mind is assess. But I'll rule out two that it can't be. If I can't rule out two, I'm only going to rule out one. But I'm going to just rule out what it can't be. And then referring the woman to battered women's groups to allow her to identify with other women in similar situations. Again, I don't know that she doesn't know that.
Oh, I'm not talking about this question in particular. I'm just talking about
okay. So in general, that's my same process. I'm not a huge fan of any of the letters or the acronyms. I just can't remember them. And if it works for you, I'm not saying you shouldn't. It just doesn't work. That's not how I teach it. So what I want to do, I want to read the question. I want to understand the question. Go down to my answers. I want to rule out two that it can't be. Then most often there's two left that are very, very similar or could answer the question. Then I'm going to go back to the question and prove why I know that's the answer. What in the question tells me that? Not what I know about anything in the past, not what I bring in, just what I can actually see in that question. Okay, so rule out two, you have two that are left, and then go back and prove it. But always assess if that's an option.
But I mean that technique really can be used
in all of them. In all of them. Whether it's community or a group or anything like that. And Barbara said earlier, be sure that you read everything, because sometimes you'll find the first part of the question is correct, but not the second part. Oh, well, that sounds really good, but I don't agree with this part. Then that's not the answer. Okay, so the whole part of it has to be correct. Some of those hard and fast rules I said before, it's never do nothing. That's not an option. We always have to do something. Those hedge words, all, none, never. When in life is it always?
Right.
Okay, so those are usually big flags. That's not the answer. That's not the answer. And I want to assess as much as possible before I make an intervention. Okay. So that's probably a lot vague for people who like the acronyms. But for me, that's a better way of looking at all the questions. And that way, I'm not trying to remember the F, the E, the R. I can't do that. Okay. And those standard rules apply. If it's physical, then I'm going to always refer out to the doctor. I'm never a specialist in substance abuse. For this test, I know nothing. I always refer those out as well. And then I'm going to... the last one. I'm the best. I'm the best social worker. I'm just the best. So refer out is never the answer, unless it clearly says it's out of my realm and seeking consultation is not an option. Then I might refer out, but the assumption is I'm the best social worker. And when do you go to your supervisor?
Countertransference.
Or transference or anything else within the clinical setting. Okay? So he is not out of, he's someone who is, someone in my relationship, in the therapeutic relationship, he has racial slurs I don't agree with. I have to work with him. I go to my supervisor. Okay. So it's in that clinical setting that is pretty much the only time I go to my supervisor. There are questions that talk about, we've talked about subpoena and court order. But if the question says you're working for a family agency, then you go up the chain of command. Okay, so if it says talk to your supervisor first, then you do that because you work for an agency. And that's really important to know the chain of command. So most often it's the person who, you're the worker. There's someone who may be your clinical director. There's a board of director. I'm sorry, CEO. And then there's a board of directors, the board of the board members. Okay. So the board members hire and fire the CEO or the big director. That's pretty much the only role they play with inside the agency. They do funding, advertising, but their job is to support that person, fire and hire her. Okay? So if it's an agency question, you go up that chain of command. You're not making near enough to make those major decisions by yourself. Throw it on somebody else because that's their job. Okay. Last one. A social worker is hired by an adolescent residential school and treatment agency that accepts referrals from public schools. Shortly after starting work, she realized that the agency is permeated with treatment ideas and management concepts that are weird and seem nonsensical. Rocks and amulets placed in dorms are alleged to have magical powers to calm the atmosphere. Staff hired to do treatment is qualified solely based on the beliefs and the efficacy of the agency's novel and improved theories. They have no significant professional credential. The agency has become ingrown and severed all contacts with professional bodies such as professional schools and professional organizations. Referring agencies are unaware of the organization's policies and treatment ideas, and these are not publicly disclosed. The treatment ideas are supported by the board, the agency director, and the top personnel of the agency. The agency's strategies are deceptive and potentially harmful. Which statement provides the best strategy for the social worker? She was recently hired by this very strange program.
You just talked about the chain of command, and this is an agency.
Okay.
So I would say number 3.
So then let's go back up to the top and prove that to me. Discuss it with her supervisor. So she realized the agency is permeated with treatment ideas. Here we go. Shortly after work, she realized the agency is permeated with treatment ideas and management concepts that are weird. So the management is very much in on it. They know.
Because I would have initially said number 4.
Okay. So, but they know, right? The agency management knows. So,
right, yeah.
In this situation, go ahead.
No, I would, and this is, listening to what you said about the chain of command, but in this situation, I would have initially said 4 because everybody within the agency agrees with these practices.
Okay. So when I said go up the chain of command, so in this one, I did say that, okay? But in this one, the chain of command seems to be as crazy as everybody else, do they not?
Right.
Okay. So if the other agencies are unaware, so this is becoming a huge danger. Okay.
Right.
The treatment ideas are supported by the board, the agency, the director, and all the top personnel.
Right.
Okay. So at this point, when they all know, then I need to do something else.
Right.
Okay. So that's the key there is they all know.
Okay.
Okay. So then I am going to do 4. Okay. This is harmful. The agency strategies are deceptive and potentially harmful. Okay. So not only do I want to get out as quickly as I can, I need to make sure somebody knows so kids don't get hurt.
Right.
Okay. So that's a serious one. Okay. Okie dokie, guys. It has been a pleasure. We will not have group next Sunday because that would be the Super Bowl. And not that I'm a fan, I just really like
me
to eat.
either. You
So,
change your mind, let me know.
Oh, you know what? My friend said, "Are you going to work Sunday night?" I'm like, "Why would I not? What do you mean?" So, but yeah, I think it's a big deal for lots of people, and the commercials are great. So that's where we're going. Okay. So I have February's is out already. Um, but then if you have suggestions for March, I haven't done that one yet. So those of you who will still be with me in March, most of you should be done.
Hopefully not.
Yes, yes, will be done with me. Okie dokie. Read those the community chapters. So that's my biggest soapbox, is just making sure you understand how communities work. I think that that's really where the test is now. And I say that again just because I have people who are really good about sharing with me what was on the test. So that way I can pay it forward, and I'll ask you in the future if you would do the same thing. I'd really appreciate that. Okie dokie. I'll
Thank
see you
you.
guys later in the week. Have a good.
Thank you.
Good
Bye.
luck, Miss Pam.
Thank you. Bye bye.
Bye.
I am so very sorry. Um, I didn't see the payment, and I didn't see a text either, so I do apologize. I will send you the tape of today's session, as well as invite you to attend any session of your choice. Again, I apologize. Mhm. And should it happen again, please feel free just to call